Through previous assessments with the proposed client, it has been found that the short head bicep femoris and tensor fascial latae are two structures that remain overactive in the kinetic chain. Today I'm going to demonstrate some self-myofascial release and lengthening techniques to ensure these overactive muscles are inhibited in order to target those muscles that require some strengthening techniques. Ideally, when beginning self-myofascial release, it is important to begin with a softer foam roller for less penetration of the soft tissue. Self-myofascial release is used to improve poor posture that creates dysfunction. SMR is used for two reasons. First, it is used to alleviate the side effects of active latent trigger points, essentially alleviating knots within the soft tissue. It also influences the autonomic nervous system, including the heart, blood vessels, and visceral organs. Furthermore, SMR is used prior to static stretching in order to inhibit muscle extensibility during the static stretch. SMR techniques works to stimulate the GTO and triggers autogenic inhibition to inhibit muscle spindles, allowing the tissue to relax. Self-myofascial release technique should be performed in one set, holding on the tender area for 30 to 90 seconds. Such technique should be performed daily unless otherwise specified. Okay, Adam, so we're going to start with some myofascial release. So through our previous assessments together, I determined that your tensor fascial latae and your bicep femoris are tight muscles. It's creating a muscle imbalance in your kinetic chain. So we're going to take this handy dandy foam roller right here, and we're going to start with your TFL. Okay. So your TFL is a muscle that we call the pocket muscle. So imagine that you're wearing your jeans. It's that muscle that you would be right over top where you'd place your hands in your jeans. So it's right here. Okay? So I'm just going to demonstrate to you the SMR for your tensor fascial latae. So what you're going to do is you're going to place your hip. You're going to place the foam roll right in front of your hip. Okay. You want to make sure that you have a straight posture, okay? So you want to have a flat posture, drive your hips forward. You're going to push your chest out and really engage your core, okay? I want your top leg to come out in front. This hand right on your hip. Okay. And this hand down on the floor for support, okay? What I'm going to get you to do is you're going to roll really, really slow. You're going to start from your hip. You're going to roll up down to your lateral knee, okay? You're going to go really slow, and you're going to try to find a really, really tender spot. When you find that tender spot, that's where you're going to stop, and you're going to hold on that really tender spot for about 30 seconds, or a good rule of thumb is when that discomfort goes away. Could be up to 90. So for demonstration purposes, we'll do 30 seconds together. You're going to hold, and then once 30 seconds is up, then we're going to switch and do the other side, all right? Yeah. So I'll get you to come down onto the foam roll here. So make sure you get set up properly. All right, so straighten this bottom leg out. This top leg's going to come out. You can bend at the knee, place the foot in front. Make sure this leg is straight. Work to engage that core. Put this hand on your hip, that one for support, and start rolling down slowly towards the knee. So roll up, and then find that really, really tender spot. Let me know when you found it.
Right there.
Right there? Okay,
yeah.
We're going to hold it for 30 seconds, okay?
That sucks.
So with SMR training, Adam, what it's doing is it's finding that tender spot where there's a knot in the muscle tissue. Okay. And this is where we have a muscle imbalance. So you have an overactive TFL, which means that there are other muscles within your kinetic chain that are a little bit weaker because this one probably does most of the work. Okay. So you're going to hold this for 30 seconds, and as you keep doing this, we encourage you to do it for every day if you can. Okay. You're going to find a difference if you roll it out every day. How's it feeling? Can you feel it going away a bit?
No.
You might have to hold it a bit longer. Good job.
Okay,
Keep this leg straight.
Starting to go.
Starting to go?
Yeah.
Yeah. You'll find that the longer you hold it, you'll find that the discomfort goes away. Good job. Keeping this kinetic chain straight. Abs are in. How's that feeling?
Better.
Better? Alright, so we've reached about 30 seconds, so Adam would flip over to the other side and do the other TFL. Alright, Adam, so the second muscle that I think is probably overactive is your bicep femoris. So it's one of your hamstrings. It's on the lateral side, on the outside. So we're going to foam roll it. So I'm going to show you how it's going to go. So when you do your hamstrings, you can do it one of two ways. You can have both hamstrings on the foam roll, just like this, or one on top of the other. When you have one on top of the other, it's a lot more pressure. So we're going to start with both, just because I suspect that it's probably pretty tight, and this is your first time foam rolling, so I don't want it to be too tender. So, same thing, you're going to draw your navel in, place your hands back to support you, and you want to keep a flat posture, okay? So what you're going to do is you're going to start up top, and you're slowly going to roll towards your knees. And to hit that lateral hamstring, you're going to kind of come out to the side here and roll until you find that tender spot, okay? So same idea as the TFL. Find that tender spot, hold it there for a minimum of 30 seconds. Drawing that navel in, keeping your shoulders relaxed. Alright, so I'm going to get you to try.
So am I doing it for one leg or two of them?
Let's start with one. So don't put pressure on top of the other because we want to try to target that outside hamstring. So doing two at a time might be a little bit more difficult.
So I have to start from head or forward like this one?
Yeah, so start a little bit higher up.
Oh, higher up.
Okay, so favor one leg. So don't put this leg on top. Just kind of roll out to the side. Okay, yeah, keeping support. Draw your core in. And you're going to roll really slow on the outside hamstring until you find a tender spot. Let me know when you find it.
It goes up a bit higher.
Go back up to that point. Right there? Awesome. So you're going to hold for 30 seconds. So this is another one of your muscles that's overactive. Alright, so I just want you to hold it there. Wait until you feel that that discomfort goes away a bit. How's it feeling?
Yeah, it's there.
Yeah? So again, because we're doing one at a time, you'll do one side and then the other.
Okay.
So 90 seconds is the longest that you should go.
Okay.
But by that point, you should feel that the discomfort kind of goes away. How's it feeling?
This one's not as tight as the other one, but it's better.
Yeah? Alright, so Adam would hold this for 30 seconds and then switch and do the other side.
Static stretching is used for multiple reasons, working to further relax the muscles and increase an individual's range of motion. Additionally, static stretching is used to decrease the risk of injury development and decreasing the work required for movement production. It is important to note that a dynamic warm-up should be included during static stretching. The static stretching technique includes a repetition count of 1 to 4 and the duration of the stretch lasting 20 to 30 seconds. 60 seconds for older patients is best. The frequency of static stretching should be daily in order to reap the benefits of the stretching technique.
Okay, Adam, so we're going to do the static stretch for the TFL and the bicep femoris. So the one that you just rolled out.
Okay.
So the first one we're going to do is that pocket muscle. So you're going to get into a staggered stance. You can do this with me if you want. One leg in front of the other. And you're going to take this back leg and point the toe outward a bit. Okay, kind of separate your feet a little bit more. Alright, so what I want you to do is think about keeping your hips pointing forward. So turn your hips forward. Alright, you're going to pull your chest up and out, the shoulders back, and what I'm going to get you to do is take this left arm right here, you're going to put it up in the air, and you're going to extend over to the side while you keep your hips pointing forward, okay? I want you to feel a really good stretch in that TFL. Alright, so I'm going to see how it's coming along over here. So maybe take a little bit wider stance, pull this leg back, there you go. Keep those hips pointing forward. Again, draw that navel in. If you can bend a little bit more.
Like this way?
You're going to go to this side.
Oh.
Keep those hips pointing forward. Can you feel it in that pocket muscle?
Yeah.
Yeah, so Adam, what you're going to do is you're going to hold it here for 20 to 30 seconds. 30 seconds is ideal. Alright? So you want to do this static stretch after we do the foam rolling. Because the foam rolling helps to really relax this muscle. Then static stretching takes it a little bit further, stretches out the muscle a bit more. How's it feeling?
Good.
Awesome. So Adam would hold this for 20 to 30 seconds, and then he'd switch and repeat on the other side. Okay, so for the second static stretch, we're going to stretch out that bicep femoris. So what I'm going to get you to do is we're going to use this little platform here. You're going to pick one leg that you want to stretch out. You're going to place it up top upon this platform. You have the back leg straight, front leg straight, okay?
Mm-hmm.
Okay, so then what I'm going to get you to do is you might have to step a little bit. Is you're going to cross this leg a bit more. So I'm going to have to place this one over to the side. Okay? Find your balance. So you're going to cross across your body here. Keeping the hips pointing forward. And then you're going to turn your toe in a bit so you can target that bicep femoris. Then I'm going to get you to draw your navel in, keep your shoulders down and back. You're going to take your arms straight out ahead of you, putting your palms together, and you're going to rotate in the opposite direction of your leg. Okay? Keeping that balance, you're going to hold it for 20 to 30 seconds.
Okay.
Alright? So I'll get you to try.
Let me at this thing.
So you're going to put one leg up on the platform. Yeah, cross your body. And I want you to point your toe inward. Keeping that shoulders facing forward. And then you're going to stretch in the opposite direction of your leg.
Oh my god.
Good job. Can you feel it?
Yeah.
Awesome. So you're going to hold for 20 to 30 seconds. Try to keep a straight posture. There you go. Draw in that core. So again, you would perform this stretch after you rolled out your bicep femoris. It's good that you're feeling it in these muscles. We know for sure that they're overactive. Couple more seconds there. Awesome. And relax. So then you would do it on the other side as well.
Neuromuscular stretching is thought to be more effective than static stretching in regards to an individual's range of motion. It is important to note that static and neuromuscular techniques do not need to be performed together. Neuromuscular stretching takes a muscle to its typical end range of motion, works to contract that muscle to be stretched, takes that muscle passively or actively to a new end range of motion, and statically holds that position for 20 to 30 seconds. Such a technique should be performed 3 times. Neuromuscular stretching techniques require a repetition count of 1 to 3, contracting that muscle for 7 to 15 seconds, and holding this new stretch for 20 to 30 seconds. Such a technique should be performed daily unless otherwise specified.
Alright, Adam, so the final element of the NASM corrective exercise is the neuromuscular stretch. So for this one, I'm going to help you stretch out a bit. It's going to take your stretch to its end range of motion, and then we're going to try to work it a bit further. So I'll just get you a little bit that way. So I'll show you what you're going to do, and then I'll help you perform the stretch. You're going to lie supine on the mat just like this. Okay, we're going to stretch out that TFL. So you're going to take one leg over, place it on the opposite side of the leg, place the foot flat on the ground. You're going to keep this leg straight, contacting the ground, and you're going to keep your hands behind your head, just like this, to support the neck and head. And then I'm going to place one hand on your knee and one on your ankle. And you're going to pull your leg in the opposite direction this way, as far as you can. It's going to stretch out the TFL. And then I'm going to ask you to contract your TFL muscle, so that pocket muscle, as best you can. You're going to hold it for 7 to 15 seconds, and then I'm going to try to pull it a bit further.
Oh my god.
I'm going to take it to another end range of motion, and we're going to hold it for 20 to 30 seconds. See if we can increase that range of motion, okay? So I'll get you lying on your back, and if you can, we'll straighten out this leg, okay? So straighten out that leg. Right there. This one's going to place over top. Go that way. Perfect. You can put your hands on your head. Awesome. Draw that navel in. Relax your upper body. Then I want you to pull this straight leg towards me as far as you can. Okay? Good. I'm going to place one hand on your knee. I'm going to push it a bit that way and one on your ankle, okay? So really contract that muscle there. Got it?
Okay.
Okay, contract and hold it for 10 seconds. And I'm going to pull a bit more. And we're going to hold for 20 to 30 seconds. How does that feel? Do you feel the
I
stretch?
just feel like a pretzel.
You feel like a pretzel. Good job. Good job. I'm going to push a bit more. Awesome. You feeling the stretch?
Yeah.
Good. So it's important to note, Adam, so remember how we did the static stretch before this?
Yeah.
I'm going to just release. There you go. Good job. So the static stretch that we did before, this is the neuromuscular stretch. You don't have to do them together. You pick one or the other.
Okay.
So then we would do it 3 more times on that side, and then we'd switch and do it 3 times on that side, okay?
Okay.
Good job. All right, so the last stretch, Adam, is for your bicep femoris. So again, I'm going to get you to lie on the mat like this. Lie on your back with your palms facing down. You're going to extend one leg up into the air, pointing your toes towards you. That's called dorsiflexion. And you're going to point towards one shoulder. Then I want you to take your leg over and to the side a bit, okay, as far as you can. From there, I'm going to ask you to contract that lateral hamstring, the bicep femoris, for, again, we're going to do 7 to 15 seconds, and then I'm going to push it a bit further, okay? So when we first begin, I want you to take it over as far as you can on your own, okay?
Okay, coach. Gotcha.
Okay, coach. All right, so extend one leg out. I'm going to stay right here. You're going to extend one up, point the toes towards your shoulder.
Just hand slide.
Yeah, just hands to the side. You're going to hold your your ankle down here.
Okay.
And up on your other ankle. So I want you to pull it towards that opposing shoulder. Take it as far as you can on your own, okay?
That's about it.
Okay, so contract this lateral hamstring. Really contract it. Hold it for 10 seconds. Ready? And then I'm going to take it a bit further. Good. And I'm going to hold it there for 20 to 30 seconds. How's that feeling?
Tight.
Tight? Gotta work these muscles. We gotta lengthen them a bit. Perfect. And come back down. How did that feel?
Good.
Feel like you're getting a stretch?
Yes.
So again, we do it 3 times, then switch and do it on the opposing limb 3 times. All right?